Hi, I'm Natasha Tracy for Breaking Bipolar here at healthyplace.com. So today I want to talk about mental illness and mental health terminology. Specifically, when people apply the words of mental illness to things that aren't mental illness related. So for example, the weather is so schizophrenic today, meaning that the weather is really changeable possibly. Or the weather is so bipolar today. You hear that kind of thing as well. People will give those types of names and those types of terminology to things that are obviously not at all mental illness related. And many people are actually really offended by this. Many people are really offended by the fact that someone would use a serious medical term in a way that is not serious medically related. Okay, I understand that. I'm not one of those people. So I believe that words are to be used, and I believe that it's totally okay to use a word that is descriptive in a way that does not refer to a mental illness. I think that when you refer to the weather, you're clearly not referring to a serious medical illness, and that using a word to describe it is okay. Nevertheless, if you choose to do that, you should be aware some people are really offended. As a writer, I believe words are to be used. Not everyone feels that way. However, sometimes people will say about their friend, or maybe their frenemy, they'll say something like, yeah, she's so schizophrenic, or yeah, he's so bipolar. In that case, people are using words of mental illness to apply to people. And they're using it like an insult, like it's bad to be bipolar, like it's bad to have schizophrenia. Well, that, on the other hand, is not okay, because that contributes to the stigma that we all feel. I, for one, do not feel that bipolar is an insult. Bipolar is an illness. That's all it is. It's neither positive nor negative. It is just something that people like me deal with on an individual basis. But by using that terminology, by calling someone bipolar because they got angry with you, or because they were suddenly upset, or maybe they had an anxiety attack, something like that, that's just not okay. That's using those words to describe a situation that is not serious and medical in nature. So words do matter, and how you use the words do matter. So the next time you hear a mental illness word slipping out of your mouth, and you're not using it to describe a serious mental health challenge, maybe you want to reconsider the word that you're choosing. I'm Natasha Tracy, and this is Breaking Bipolar.